Hi, and welcome to the Eczema Podcast, where you'll learn tips, products, and natural eczema remedies from Abby, registered holistic nutritionist and founder of PrimePhysiqueNutrition.com. Stay tuned as she invites experts in the field. Here's your host of the Eczema Podcast, Abby.
Hi everyone, welcome to the Eczema Podcast. I'm here today with my special guest, Dr. Peter Leo, who's a medical doctor, and he's also a clinical assistant professor at Northwestern University. He's also one of the co-founders of the Chicago Integrative Eczema Center, which blends both alternative, holistic, and conventional treatments. It's really awesome. And he also got his degree from Harvard Medical School. He's done his dermatology training at Harvard, and he serves on the scientific advisory board for the National Eczema Association. So thank you so much, Peter, for joining us today.
It's my pleasure. Thank you for having me.
No problem. So I'm excited to welcome you here. And can you tell us how you got into the eczema specialty?
Yes, it was a tough story because it was really a series of patients, and one in particular that had really, really bad disease. They were really suffering. The family came in crying. They had seen a number of different specialists, and they just wanted answers. And more importantly than even answers at that point, they just wanted relief. The baby had not been sleeping for weeks and weeks, so the family hadn't been sleeping. And it just struck me. I'm like, this is broken. We need to do more for this. We need to have a better setup. And, of course, we don't have a lot of time per patient. And so I said, we need to think out of the box to get these folks better.
Mm-hmm. Is that also when you started the Chicago Integrative Eczema Center?
This actually was long before that. This was when I was still back in Boston. And even back in Boston, I started toying with the idea of a center devoted to this. So that was then. And then I moved to Chicago in 2008. And when I joined faculty at Northwestern, Dr. Amy Paller, who's one of my mentors and heroes and is truly an eczema guru, she said, you're going to do this. You're going to make this happen. So the first one was actually hosted at Northwestern. Then a few years later, I snuck out to a private office to have a little bit more control. And so then I was able to do something even a little bit more unique and make an integrative center at Northwestern. That wasn't maybe quite the goal. So this allowed me to be truly free. And now that's been going for almost 4 years now.
Wow, that sounds very exciting. So do people fly in from different cities, or how does it work usually?
They do. I would say most of our patients are regional, so they're in the Chicagoland area or from the greater area, sometimes adjoining states. But we have had people fly in from California. We've had someone fly in from the UK. We've had people come in from New York and Pennsylvania. So it's kind of interesting to have people come from far away and spend part of the morning with us. And sometimes they're just there to listen and learn because we have a big didactic session that starts out with sort of an introduction to eczema and talking about sort of what we know and our general approach, and then if they want, they can be seen as a patient too, which is really fun.
Okay. Do you find that there's a certain treatment that works better or that works best for your eczema patients?
I think that's a great question. The hardest part about this disease is that it is not one disease. And so as soon as somebody says, oh, I can fix all of it, I'm like, I think that's a fib because it's not one disease. So anything that supposedly works for all of it is probably false. Most of my patients really need different pieces of the puzzle. And sometimes things that I'm absolutely certain are going to help a patient totally fail. And I'll reverse and go in opposite direction and say, son of a gun, this is a different subtype than I thought, or it's responding to a different set of approaches than I thought. And it's a very humbling disease, and it's a disease where you're learning a lot. And so that's exciting too, that it's the Wild West a little bit.
Mm-hmm. So what types of treatments do you use at the center?
I think, my training is mostly in traditional sort of Western medicine. So we're going to do conventional things first. But I also spent a full year studying traditional Chinese medicine and acupuncture in Boston, which was amazing, incredible year. And it changed me completely. It reopened my eyes to medicine in a whole new way. I then spent a second year learning more about it and doing more hands-on training, which was incredible. So I think we kind of start with the basics. And truth be told, I think of the basics as not really being part of one tradition or the other. I think that they're just great things. So for example, good moisturizing. That's important. I don't necessarily think that's a Western concept. I think just protecting the skin and soothing it can be done a number of different ways. Sometimes it's done with a plant oil. Sometimes it's done, with something more natural. Other times maybe something a little bit more synthetic. But the idea is very similar. The other thing is bathing. We actually think that most of our patients do better, not all, but most of our patients, because again, this whole subtype issue, with a daily bath or even a twice daily bath when things are really bad. Now, this is a little bit controversial because many patients are told, hey, don't bathe too much. You don't want to take away the natural oils. And what I say is that that's absolutely true, especially if you're using plain water, or even worse, if you're using like a traditional soap, a rendered fat soap, which is usually rendered with lye or a very strong alkaline substance, then that is perfect advice. Don't bathe. It's better just not to. But we're going to add special oils to the bath. We're going to make it so that as soon as they come out, when the skin is supple and soft, we're now going to add our medicines and our moisturizers and lock that water in. So then it can be sort of spun around to be a very powerful treatment and really help the skin.
Interesting. So you mentioned that if you include oils in the bath or in the shower, then it helps the skin?
Yes, for many patients, putting different types of oils in the tub or even when they shower can make a huge difference. The skin, when it's soft and moist, that stratum corneum top layer is very, very pliable, and the ability for good fats and good calming substances to get in there is much improved. So it's a great time. And then if you seal those in with an occlusive moisturizer, and again, that could be a petroleum product like Vaseline or something, or if you didn't want to use petroleum, it could be a natural wax. There are all sorts of interesting natural waxes that we use in combinations of waxes, such as beeswax, that can do a similar job sealing up the skin and keeping that water where it belongs.
Awesome. So what types of oils would you recommend if people were to put it in their bath?
My favorite one for the bath is sunflower seed oil. As long as you're not allergic to it, it's a wonderful oil. It's high in gamma-linoleic acid. It's incredibly soothing. It has both anti-itch and it has moisturizing properties directly. So it can really do kind of two things at once, and we love it.
Awesome. And I know we talked earlier before this, but you mentioned something about coconut oil as well, being a gentle product and a gentle moisturizer.
Yes, I'm a big fan of coconut oil, particularly virgin coconut oil. And the reason we make that distinction is that older coconut oils were sometimes extracted. In the past, they were extracted with solvents like hexane, which is kind of a nasty chemical. And we don't really want residue like that around. So we want virgin, which is sort of cold pressed or expelled without a lot of treatment and a lot of refinement. But there have been a couple of studies that have shown that it has powerful antibacterial effects against the bad bacteria on the skin and eczema, the Staph aureus that's overgrown, but it also is a really good emollient and skin barrier improver. So again, both of those oils, particularly together, I use them a lot together, sunflower and coconut, and I think they're just really, really powerful for most patients. Again, barring allergy. We do have some patients who are allergic or even suspected allergic, so then we want to be a little bit careful and tread lightly, but most patients do well.
Okay. Are there any other types of gentle products or gentle moisturizers that you would recommend our audience?
I think that there are a number of really neat oils out there. I think that jojoba oil is very nice. It's technically a wax when you look at its kind of chemical structure, but it's a really nice protective oil. Some people like grapeseed oil. Borage oil is a wonderful oil too, and evening primrose. Despite the fact that there have been some recent studies saying, well, borage oil and evening primrose maybe don't help eczema that much when you ingest them, I still think as topical oils, they're very, very nice. One of the hot new ones, and this can go on and on. The problem with alternative medicine is that it is a bit of an endless category. It's anything and everything that sort of isn't sanctioned. So people can sometimes say, hey, have you heard of emu oil? And have you heard of this kind of particular variant of mink oil? And what about sea buckthorn oil? So it could go on and on and on. But I think a lot of the natural oils are pretty nice. The only oil that I recommend against, I think that's worth saying, is olive oil. And you have to know I'm Italian, so I love olive oil and I eat it with everything. It's in everything we eat practically. But it turns out there was a very interesting study that showed when you put it on the skin, it actually damaged the skin barrier. And so we don't recommend. I don't know why that is. There are many natural oils contain thousands of chemicals, so we don't know why. But I tend to recommend against olive oil, and I tend to recommend towards sunflower, safflower, and some of the other ones we mentioned.
Okay. That's interesting because I did have a time when I flared up really badly on my skin, and I started using olive oil a lot. And my acupuncturist at that time actually told me to stop using it, and I stopped using it, and I found that my skin was a lot less dry.
Interesting.
So, yeah. So it goes along with what you said.
That's neat. Now, I definitely, to that point, I also have patients who swear by olive oil. And, again, your mileage can vary a little bit, and these effects are probably minimal. But if my goal in thinking about integrative medicine is, can we put every possible gentle treatment together? Even if they seem kind of goofy, it's like, oh golly, who cares what moisturizer they use? Just pick a moisturizer. But I'm like, no. If we can find the best moisturizer for their skin, maybe that's the difference between sleeping tonight and not. Maybe that's the difference between needing to use a topical corticosteroid and not. And so we try to maximize every other point to the point of obsession. We're thinking, what else can we do to get you better? Until that point where we say, okay, we've really tried in earnest, we're stuck. Now we might need to lean on conventional medicine for a bit, and we're careful and we're trying to really balance that and be respectful of it, but to get people past a hump, and then we try that all over again.
Right. Have you ever seen people that have used natural oils to seal the skin and act as a moisturizer for the skin barrier to the point where it healed the skin and eczema and they didn't need any conventional treatment?
Absolutely. And I think for milder cases of eczema, and particularly for just dry skin type eczema, that can often be enough. Just good moisturizing, natural protection, that seems to be great. Now there's some new evidence that just moisturizing babies can potentially prevent the development of eczema, which is gigantic. This is a huge revelation for everybody, and so that's exciting too. So yes, the problem is most of those patients don't see me. They get better before they come to my office. So I'm stuck, unfortunately, with a group of folks that they've tried everything. They've gone gluten-free and dairy-free, and they've changed the formula and stopped breastfeeding and put the kids in a bubble and moved from Minnesota to somewhere else, and and then they say, we're still stuck. What do we do now? And so this is a very different kind of patient that I'm unfortunately, I want to help. I'm stuck with this.
Wow. What do you think it is for people who've tried diet, they've tried a lot of different things to help their eczema, as you've mentioned, and nothing seems to work?
So I think the hardest kind that I face is really what I call the immune subtype. And these are people that tend to have, their pattern tends to be red all over. It's like very widespread. Okay. They tend to have face involvement and a lot of scalp involvement. They tend to have tons of allergies. They often have high IgE levels in their blood. This is sort of my nightmare patient because their skin really seems to be more of an innocent bystander. It's almost like their skin is just stuck in this loop, and if we're focusing on topicals, it's not enough. They need more. So these are really tough. My favorite kind of eczema to treat, the one that's sort of the easiest, are the dry skin patients that have kind of scaly, sort of lizardy skin, the so-called ichthyosis pattern. Those tend to do well, even though if you read the literature, many people say, oh, they're more severe, but I find they respond much better to our topical therapies. Their immune system seems to be kind of secondarily getting whipped up into a frenzy. So it's like if we seal your skin and protect you, you usually don't need as much aggressive stuff as the other case. So those are, we get both. I have a mix of both and other subtypes still.
Got it. I would have been your worst patient. I had
perhaps,
red.
But if you come over, you might come over and see some pretty severe patients on a Saturday when we have the center. Wow. It can be pretty depressing.
Wow. Yeah, that's really hard. Yeah, I had rashes all over my face, and then my scalp was peeling like big flakes, and it was. I'm glad to be out of that phase, but I'm glad for what you're doing because it seems like it's helping a lot of people as well.
Thank you.
But I also saw that your center has support groups, so that looks pretty neat.
That's really a really important part of it too. The support group is something that even when patients are better, sometimes they still come, because even if you get better, even if you're cured, which is a wonderful word, which we were very careful with that. We call that the C word in National Eczema Association, that you have to be careful with that word. Cure is a powerful, powerful word. But for patients that really, 5 years have passed and they say, boy, I haven't had any flare-ups, I feel great. For those patients, they still sometimes come to support group because when it was bad, well, as you know, it was the worst time of their life. They weren't sleeping, they were miserable, they hated themselves, they hated their skin. So it's a disease that sticks with you. It's a miserable, miserable disease.
Mm-hmm. Yeah, I can definitely relate to that. It's hard. So tell me about acupuncture and how that's helping with eczema.
So acupuncture is amazing. I think that it can do so many things. I think the biggest Western misconception about it is that it's like a magical cure-all thing. It's not that, it's not magic, but it is kind of like a magic for some patients in that it can help with itch directly. It seems to be able to calm down the immune system. It seems to be able to calm down anxiety and stress, which is a huge part of, this, when you're stressed out, it flares. When my students are studying for exams and they're not sleeping right and they're eating junk, they fall apart. Their skin falls apart. So if we can use acupuncture to help calm that down and get them better, it can be incredibly powerful. But by itself, it's probably not enough for most of my severe patients. Okay. For milder patients, it can do it. It can do the whole job. But for severe, it's part of their plan. It's one piece of their treatment.
Is it possible that if people go to an acupuncturist who isn't that great at or experienced with eczema, that the acupuncture doesn't do anything to their body?
Yes, and that's another problem when people ask me about, does alternative medicine work? Does traditional Chinese medicine work? Does acupuncture work? It's a hard question because a lot of it is provider dependent. My teacher, Kiko Matsumoto, is amazing. She has a whole school of acupuncture named after her. She's a magician and a very, very experienced practitioner. So I trust her with my life. When I watched her work, you don't doubt her. Kiko will find a way. But that being said, someone else who maybe has done a little bit of training, even myself, I know enough to be dangerous, but I don't really do much primary acupuncture treatment myself. I still work with an acupuncturist because my day job is a dermatologist. That's what I'm good at. I'm not going to quit that for my acupuncture. I just wanted to learn about it. So you really want someone who knows what they're doing, who's been through a lot, and who is going to also know when things aren't going to work. And the most powerful moments with Kiko, my teacher, would be she'd say, no, I can't help you. This is not going to work here. You need more than this. This is beyond me. And to me, as a practitioner who's also, pretty confident in his skills in dermatology, I respect that. That's one of the hardest things to say. And also the smartest people really are the ones who know their limits. It's amazing.
Wow. Now, I know one thing we want to talk about as well is what happens with patients with eczema in the long term. What's your experience with that?
So first, the good news. The good news is that most of the kids with it, the vast majority, I would say probably 80 or 90%, really do get much, much better as they get older. And so even if you do nothing, even if you just say, we're just going to wait it out, they're going to get better for the most part. That being said, not everybody, right? Because even if it's 80 or 90%, there's still a group of people that suffer the whole time. Also, they get better, but it doesn't mean it goes away. Many of my older kids still can have flare-ups. They still are sensitive. They still can have a miserable day here and there, even though it's not like it used to be. So we have to really, really keep an eye on them. And I tell them, you'll probably never be able to go to some, bath and body workshop and just try all this fragrancy stuff on. Like, that's not for you. You might not ever be able to just go and pig out on a bunch of junk food if food is one of your triggers. You may have to be careful and kind of control your skin and control your body, but I spin it in a positive way. I say, you are sensitive. You are a sensitive person in the world. Your body can pick up things better and stronger than other people. And so you have to, with that great power comes a great responsibility, and you have to be careful and control your environment.
Right. Now, what about new onset eczema in adults who have no history of eczema or allergies?
Super interesting and very difficult. So these patients, these poor adults, are caught off guard. They've never heard of anything like this. They are just miserable and itchy. It tends to be super severe. The most important thing for a new adult or even an older kid, I'd say if you're, even a 5 or 6 year old who comes out of nowhere with new symptoms like this, we have to make sure that's really what's going on. We have to make sure that it's not a true allergic dermatitis because, right, that's very different than atopic dermatitis. If you are just allergic to something, for example, nickel. People get allergic to metal in keyboards that they're working on at work, even into iPads, and some of these aluminum coated things have a component of metal. And so we've seen this over the years growing. That's a wonderful diagnosis because you can say, holy guacamole, this is what's causing it. If you avoid this, you are cured. You don't have to do anything. There's no steroids, there's no nothing. You're just done. Just avoid it. It can be chromates. It can be things like MCI, all these different allergens out there. So we test for that. Sometimes more scary stuff would be certain cancers in adults can actually present as super dry, itchy skin. So particularly lymphomas can do this. And I had a patient a few years ago, a wonderful, wonderful lady who had terrible, terrible hand dermatitis. And we were doing all this stuff and trying all these different things. We could get her better, but we could never get it clear. And we did all this workup. And finally, it turned out she had a huge lymphoma. And this is how it was manifesting. Her immune system was broken and she passed away. And her family was just wonderful, and just was a huge outpouring of emotion and gratitude that we tried everything to help her get better. But it was weird. I thought, why isn't this getting better? What's wrong with this? And we got our answer, and it was a terrible, frightening answer. Super rare. I don't want to scare your listeners or your viewers. It's not something we see commonly, but we do need to ask that question: why am I not getting better? What else is going on? What else do we need to do to make sure we're doing everything we can?
Yeah, that's definitely true. I love your heart for helping people, and I can see your passion in just talking about eczema.
It's the kind of disease that motivates people, right? I mean, it can ruin lives. So if we can band together and fight against it and do good stuff to understand it, it's a worthwhile cause.
Yeah, for sure. Now, what about babies with eczema? How do you approach them differently?
It's my hardest group. It's what wakes me up in the middle of the night in a cold sweat. The hardest part for me is that parents blame themselves immediately and frequently. It's my fault. We're doing something wrong. There is also a lot of desire to find the root cause, and we want that too. Let me tell you, I would pay anything to find the root cause of this disease. It's something that's elusive. That's really what pushed me into acupuncture. I wanted another perspective. I felt just so unfulfilled and unsatisfied. And I can tell you that the traditional Chinese medicine explanation is interesting and beautiful, but no more satisfying. It's still not a root cause. To say that somebody has liver yang excess, why? I don't get it. Why? It's more of to say, it's almost like saying somebody has really, really dry, leaky skin, which is compelling too, to a certain extent, but doesn't get to the root. But so with the babies, the hardest part is the parents blame themselves, and they really focus on food. And the problem is that food can be a real issue for a lot of the kids, but sometimes it's not. And again, this is this whole idea that it's not all one disease. There are multiple subtypes. And what's really heartbreaking for me is parents will say, okay, mom says, I thought it could be something I'm eating, so I'm breastfeeding the baby. So I thought it's something I'm eating, so I cut out dairy, gluten, you name it, nightshades, sugary foods. I'm basically eating broccoli and rocks and goat milk or something, and it's like, okay, how's the baby doing now? No better. So they said, we're going to pull off breastfeeding. And I'm like, oh, don't do that. But they do. They stop breastfeeding and they go on an elemental formula, or sometimes it's multiple different ones. We're going to go on a soy formula, then we're going to go on this formula. Then now we're basically eating puke. We're eating vomit, which you can't be allergic to anymore. These elemental formulas that are terrible. And the poor baby is eating it and doing okay and growing, but their eggs is terrible. They're a mess. And so then you're left with this mom sobbing who says, I gave up breastfeeding because I thought that was the answer. We did all these crazy things and we're still right back where we started. So it was all for nothing. You have to understand, I see that once or twice every week of my life. And so I get real, my fur gets, what's the word, riled up, like the cat's fur rearing up.
Yeah.
When I hear people say, oh, it's just food, like, come on, just eat your way to health. It's so easy. Quit being a wimp. I'm like, are you crazy? You got to talk to these patients. These poor parents they've screwed up their whole life. They've stopped breastfeeding. They've done all this stuff, and it's not the answer for them. So I get very, very, very excited about people saying that they got a simple cure. And this is one of the ones that I'm really cautious about. What I often end by saying is, if food works for you, oh my gosh, I'm in heaven, because you're done. You don't need to come in. You're set. You're finished. I would also argue it's probably not atopic dermatitis as we know it. You probably had something a little bit different, a very specific kind of food allergy with an eczematous reaction, because I would argue by definition, atopic dermatitis is multifactorial, which is also why it's a maddening disease. Wool makes your skin go crazy. Fragrances make you itch and scratch. Season changes drive you crazy. Stress brings it out. Bacterial infections are going crazy. Your gut microbia is all screwed up anyways from birth. Even when you're in your mom's womb, day one, they check gut microbia. It's different. Your gut flora is abnormal. So there is more to it than just eating. Eating is important, of course. And I know that's an important part of your healing, and I think that's wonderful, and I don't mean to undermine it, but that's what I get excited about when it seems so easy. Why can't we just simply solve it by food?
Right, I see. Yeah, there's definitely so much to eczema. I know it can get really complicated for sure. Do you have any last words of advice or I guess things that you want to leave our viewers to in their mind after they listen to this podcast?
Absolutely. First, you're not alone. There are lots and lots of people just like you suffering, And so never feel alone, because so many people feel alone, and it's crazy. I go from room to room to room with people feeling alone. And so that's part of why we built the center. We said, come in, meet each other. It's so powerful. And it's such an emotional moment when everyone comes together and says, oh my gosh, I'm really not alone. This person's just as bad as me or has been as bad as me in the past. And so that's incredibly empowering. The second thing is you shouldn't suffer. The whole purpose of medicine, the whole purpose of me, of doctors, of medical school, of the whole system is to relieve dis-ease. So if you're miserable, something's wrong. We can help. And if you're frightened about regular treatments, then find somebody who's interested in doing alternative stuff with you. But don't give up. Keep searching, keep finding it, because there's no reason to suffer. And there's now pretty good evidence that the longer you suffer, the more that the skin is broken open and miserable and infected, the worse off you're going to be. So I really feel strongly to find someone you're comfortable with, find a good healer, and get healed.
That's great to know. Do you also have a website or some sort of contact that my audience can visit you at or contact you if they're interested to learn more?
Absolutely. It's just chicagoeczema.com.
Awesome. Thanks so much. It's been so great having you on the show today. And I know that I especially have learned a lot. So I'm sure my audience has also learned a lot. So thanks so much. I appreciate your time.
Thank you for having me.
No problem.
Thanks for listening to the Eczema Podcast, and stay tuned for our next episode. If you like what you just heard, we hope you'll pass it along to your friends and colleagues. Visit primephysiquenutrition.com for more articles and tips. Thanks for listening.